I am Dr. M.S. Reddy. I am a senior consultant psychiatrist at Asha Hospital. I am the director of Asha Bipolar Clinic, generally known as ABC. This is a clinic which is sort of conceptualized by me. I have about 4 decades of experience in clinical psychiatry. Almost from 1980 I have been practicing psychiatry in the private practice. The last 2 decades I developed a special interest in this field of mood disorders. ABC is a specialty clinic for mood disorders and OCD. Now let me go a little bit more on this. What are these mood disorders? Mainly the moods. You feel sad, you feel high, you feel angry. This is what we call as. When we look at mood disorders, there are 4 different types of mood disorders. One is a bipolar disorder where the 2 poles for some time they are very high, sometimes it's very low. It's episodic, ups and downs. What we call is ups are very high, downs are very low. It is what we call as bipolar disorder. The second is a simple major depressive disorder where it's mostly the depression. You feel low, you feel dull, you feel lost, literally like the bottoms are slipping under your feet. That's the state they are in, totally helpless, hopeless. Third is a minor variant of this, pre-menstrual dysphoric disorder. This is in women just around the period of menstruation. It's almost like the depressive disorder, but on the very what I call is a mini depressive disorder for 4-5 days, which subsides once the periods start. The fourth one is an interesting thing which we call as disruptive mood dysregulation disorder seen in children. It's supposed to start below the age of 10. Mostly the problem is anger, uncontrollable anger, adjustment problems, irritability. This is what. These are broadly 4 different types of mood disorders where predominantly the mood, whether it is feeling sad or feeling very high, feeling irritated, anger or anxiety, these are part. Coming to the obsessive compulsive disorder, this is one disorder which from a clinician point of view is very fascinating, but the patients suffer the most in this particular disorder. What we say, the repetitions is the core feature. Repeated thought, which we call as obsession, repeated action, which we call as compulsion. This is a mixture of these two, OCD.